that ma'am, how do you feel about the being the contributor in the Homeopathy 360? And what do you think that how this platform helps students, homeopaths, and practitioners?
Yeah, it is good. I mean, y'all are doing really good. Y'all are covering. I have seen your channel, so y'all are covering like a variety of topics ranging from organon to materia to clinical subjects to even the entrance exams and all. So y'all are doing really good. I mean, it can actually y'all can cater from the students to young practitioners to even good old practitioners or practitioners who want to come back. So I think y'all are doing really good.
Thank you so much,
Yeah.
ma'am. And do you think that the way Homeopathy 360 is, it making the practitioners and students available that they can see the webinars on various topics from various experts in the field.
Hmm.
So, do you think that attending webinars will be helpful for students?
100%. See, offline seminars also have their own charm where you can attend the seminar one to one. You can always ask your doubts. But then for going back and then when you want to hear the same thing again or you want to cover a variety of topics, I think that's where webinar comes in. You have any doubt, you search and then you get a series of lectures from many physicians or many channels and then you can attend whatever you want. So you can always educate yourself. So
Thank you
that is
so
there.
much, ma'am. And I would also like to inform all the attendees present here that 360 also publish the articles and the research papers, case studies that they have submitted on the Homeopathy 360 platform online. And this allows the authors to have their publications online, and it also engage the our homeopathic fraternity, and it is very helpful for the students also for the academic purpose too.
100%, yes.
So now I think it's a good time to start.
Okay.
Hi everyone, this is Dr. Mansi back again with the another brilliant webinar that we are going to have. Today we have Dr. Aditi ma'am on the very interesting topic today, that is pediatrics through the homeopathy lens, approach to common and chronic childhood disorders. First of all, ma'am, a very, very warm welcome to you. And
Thank you.
let's have a quick introduction about Dr. Aditi Salvi, ma'am. That is, she is a dedicated homeopathic pediatrician with a passion for holistic child healthcare with over 20 years of clinical experience. Dr. Aditi specializes in treating a wide range of childhood conditions, ranging from recurrent infections, allergies, eczema to growth, behavioral, and development concerns. Dr. Salvi integrates classical homeopathic principles with modern, sorry for the interruption.
I can't see your video too.
Okay, that's fine, ma'am.
Okay.
Dr. Salvi integrates classical homeopathic principles with modern pediatric understanding. Her approach goes beyond treating symptoms, focusing on strengthening a child immunity, improving overall well being, and promoting healthy growth and development. Dr. Salvi has also authored articles in national homeopathic journals and popular newspapers, recently being in Times of India on Doctor's Day, bringing awareness to parents about the role of homeopathy in children's health. Currently practicing at Thane, Mumbai, Dr. Aditi is known for her compassionate consultations, child-friendly approach, and commitment to empowering parents with knowledge about holistic health. And that's really a very, very great introduction about the Dr. Salvi ma'am. Thank you so much, ma'am, for coming on this platform of Homeopathy 360 in the series of Teach Beyond Boundaries. And before starting this title, Ma'am, would you like to share your experience with the patients, that your patients are uh, children? So how your experience with these type of patients? Like how much do you like to deal with small patients?
Okay, first of all, thank you for that wonderful introduction, Dr. Mansi. So basically, I had myself selected the MD degree as pediatrics. I did my MD in pediatrics. That was my choice because I love kids, and it has been a wonderful journey of 20 years. It is it is quite challenging as well because you deal with kids from neonate, newborn kids till adolescents when there are teenage. So then when a small kid comes, they don't speak. So everything is upon the observation and your clinical knowledge and materia medica knowledge. But overall, it's been a very good journey. It's always good because kids always love to take homeopathy as our medicines are always sweet in taste. So that's an added advantage. They want to come to you. So it's been a very good journey overall till now.
That's
Thank
really great, ma'am. And also that parents also like to, give their child homeopathy from the very beginning of their childhood, as they also develop the immunity very well, and like other medicines, they can easily eat.
Yes, 100%. So homeopathy deals in both acute and chronic. So in chronic, we build up the immunity, and in acute cases, we remove the acute symptoms. I'll sail you through with my presentation in that.
Surely, surely, ma'am. So, ma'am, let's start your presentation. We are eagerly waiting for your cases and your expertise.
Sure, sure. Okay. So let's begin. I'll share my screen. So I
Yes,
have a
ma'am.
presentation. I'll speak. The presentation will also speak, but I will also explain what I have written in the presentation. Okay.
Okay.
Okay. Okay. So, okay. So can you see my presentation?
Yes, ma'am, I can see.
Okay. So let's begin.
Yes, ma'am.
Okay, so my topic is, of course, Dr. Mansi have mentioned it as pediatrics through homeopathy lens, approach to common and chronic childhood disorders. Okay, so now I'll give a brief introduction about pediatrics first and then the homeopathy part. So I am not sure that you all are aware about the pediatric age group. So I would just like to introduce that in a short slide. So there are this pediatric age group scientifically and clinically classified. First as newborn or neonate, where the child is from 0 days to 1 month, and sometimes before a few kids are preterm kids also. So the term is given as preterm when the child is born before 37 weeks of gestation. Okay, then the next age is infant when it is 1 month to 1 year. Then it is toddler 1 to 3 years. Preschool age is 3 years to 6 years. And then it is termed as school age child when the age of the kid is between 6 to 12 years. And from 12 to 18, as we all know, as teenage or adolescent. More than 18 years is always adult, and it goes as young adult and old adult. So we in pediatrics deal from 0 days or a preterm kid till 18 years. So now homeopathy in pediatrics. Okay, I'll just explain how homeopathy is useful in the pediatric age group, like how, what all we can help, and then we will go through each of them in detail. So homeopathy gives us a holistic and individualized care. So this is specifically for very young students to give them confidence that you can treat a newborn as well as infant and pediatric age group. So I've made this slide. For the practitioners, if there are young practitioners, I'm sure you all are aware of this. Okay. So homeopathy offers a holistic and an individualized care. So it focuses on the child's constitution and overall development, addresses what physical, emotional, and behavioral aspects. What is the scope of application of homeopathy? Acute diseases, chronic, and behavioral and functional disorders. So acute, what acute diseases usually we see in our clinic is fever, respiratory diseases, GI diseases, and infectious. These are the most common, and this is the bread and butter if you are practicing in pediatric age group. Fever, cold, cough, diarrhea, And chronic diseases common are allergies, asthmas, atopic conditions, bowel irregularities, and so on. And functional and behavioral concerns like sleep irregularities, lack of appetite, the child is eating well but not gaining weight, or the child has no appetite and no weight gain, hyperactive kids, then delayed milestone, developmental problems, and so on. Okay. And also, homeopathy has a preventive potential, like it can strengthen the immunity, and hence, by strengthening the immunity, reducing the recurrence and supporting the growth and development of the child. What is the clinical relevance of homeopathy? It helps in acute diseases. It enhances the natural immune response, minimizes the recurrence of illnesses, and it acts as a supportive in integrative pediatric practice. What is integrative pediatric? When you integrate with other system of medicine like allopathy or any other system. So example is palliative measures in childhood cancers. We can always offer as homeopaths palliative care along with the integrative modern medicine, which is gone. Last but not the least, safety and acceptability is the homeopathy is, as we all know, very safe, gentle, very minimal side effects. I will not say zero side effects, minimal side effects. It is non-toxic, very child-friendly administration. Sweet pills gives us an added advantage in the children, and it is trusted by parents for long-term care, acute and chronic, because they know that there is no side effects. The long term will always help in building up the immunity. So this was a short description about like how homeopathy will help in pediatric age group, acute, chronic, behavior, and developmental. Okay, so let's go further. Am I audible and visible? Everything is clear, Dr. Mansi? Okay, so
Yes,
let's
ma'am.
go. Okay, so let's go further. Now, approach to common childhood disorders. We will go first with acute conditions, then I will explain the chronic conditions and what remedies, and then we will follow by the case presentation. Okay, so now acute conditions. Now, what are the important factors during in when you are dealing in your clinic with acute conditions of the kids? First is important factors. First is case taking. So now in the case taking, very important is the ODP, the onset, duration, and progress of symptom. Since when it begin, since how it has begin, and how is the progress of the symptoms. Second is the location, sensation, modality, and concomitant. I'm sure who are students will always relate with this because we are taught this, but this is the very basic and very important aspect of case taking. You should know the location of symptoms, the sensations, the modalities, and the concomitants. Concomitants are any symptom which is associated with the presenting complaints. Okay. The next is any associated symptoms. So like if the child is having fever, what are the associated symptoms along with fever? Fever with cold cough, fever with burning in urination, fever with diarrhea. So any associated symptoms. The next very important in homeopathy history is any changes in the thirst and general physical generals. So like any sudden cravings and acute conditions, many kids crave for like, I had a kid who craved for eggs whenever the child had fever, and he was a very classical calcarea cup child. So there are specific changes in the thirst, in the cravings, in the aversions, in the thermals, like in the modalities, feeling more cold, or feeling more hot, while the acute symptoms are going on. So that history is very important. Activity of the child. In pediatric cases, you have to inquire about the activity. Is the child active? Is the child dull? We always expect that if the child is ill, he or she is going to become dull. No, sometimes during high fever, the child becomes more active. So that the remedy selection changes also if there is lot of mental activities, like if the child is talking too much in the fever, it will not only help you to select the homeopathy remedy, but yes, your clinical knowledge will come into picture to know that whether the child is going into delirium. So how high is the fever, Why is the activity increased? So activity of the child is very important factors. A very normal, active, hyperactive kid suddenly becoming dull in the fever is also a contrast. So this is very important factor in the case taking of acute conditions. Then examination of patients. You have to examine every child who comes to you in acute or in chronic. You have to examine the mouth. You have to examine basically the ENT, the ear, nose, throat. You have to examine the nails. You have to examine the teeth. You have to see the eyes for pallor. You have to palpate the abdomen. You have to auscultate the chest. You have to check for the palms, the soles. You have to examine every child which comes to you with any acute or chronic conditions. Investigate if necessary, very, very important. In homeopathy, we believe that the remedy is going to treat everything. Yes, it will, but you should know when to investigate, when to always be open to refer to modern medicine specialist or even the senior homeopaths. When, like, suppose if there is a case going on and you don't see much improvement, you should be always open to refer the patient so that the trust with the patient goes on. And also it does not you don't become stubborn with your pathy so much that when you see that there is no change in the symptoms or there is aggravation of symptoms, you still keep on giving the medicine without that confidence ki dekha jayega. No, you have to refer. If you feel, take a second opinion, you speak to the senior physician or send the patient to the specialist. But yes, always be open to referring, always be open to investigating. So in acute conditions, these are the very, very important factors during case taking: ODP, LSMC, associated symptom, generals, activity of the child, examination, investigation. Now we begin, after case taking, we begin with one acute conditions. I'll emphasize more, which are very common acute symptoms, like the more in this last 20 years of my practice, kids have come to me for fever, acute cold and cough, acute diarrheas or GI disorders, or sudden skin ailments. These are the four main important acute symptoms for which your OPD will be full. And this are your main bread and butter, and you have to be clear about this. So let's go step by step into it. First, we will cover fever. Now, what is main important thing when a child comes to you with fever? A temperature chart. You have to tell every parent to maintain a temperature chart along with time. So you come to know that what time and what time the fever began. You come to know how much was the fever, and you come to know in a span of 2 to 3 days how much was the frequency of fever. Is it reducing, is it not reducing, which will help you to know the progress of the disease. We cannot just give medicine and call them after 4 days or 3 days. No, you have to maintain, every parent has to maintain the temperature chart. So if the parents say nahi maine garam maine touch kiya, the parents are very smart because the child becomes very irritable. Now you put a thermometer in a 2-month old kid, he's not going to allow. But without a thermometer, you will never come to know. There are kids whose body is very hot, but the temperature is only 100 degrees. When you touch it, the parent might feel, oh my God, it was very high fever. I directly gave Calpol thinking it is 101. No, it can be 100 also. When a temperature is not touching 100, you don't have to give any antipyretics in homeopathy or even in allopathy, because that is the body's defense mechanism. Body is fighting a infection, so it is going to show as rise in temperature. So you have to allow the body fight. That's where the temperature recording comes into picture. You record, you are checking the thermometer. If the temperature touches 100 degree, then you have to start the medicine. Till then, you can always wait and watch. Also, if there is a frequency of fever is coming every 6 days, or every 6 hourly, sorry, in the first day, it has to reduce. On the second day, it has to become every 8 hourly, then every 12 hourly. There has to be a decline trend, which helps, which makes us realize that our medicine is helping, the child is improving. But if the trend of fever does not decrease by the second day, in 2 days time it is every 6 hourly, the third day you have to investigate. Otherwise, you have to know, otherwise it is very clear clinically that if the fevers are bacterial fevers or viral, any viral to 5 days, sometimes 7 days. So till 5 days, you don't have to worry. I always tell my parents that the fever will stay for 5 days if this is viral fever, but we need to record the temperature so that we know the trend is declining. But if it is not declining, we will investigate on the third day. But if it is declining, be rest assured your child is going to be temperature free in 3 or 5 days. So that gives a lot of confidence as a practitioner, as a homeopath, to the parents, that as a homeopath given to the parents. So the parents are very confident. My doctor has said the fever is declining, so it is improving. And it gives a confidence to you as a doctor that you know the medicine is going right. Fever cases, always be in touch with the patient every day or every 2 days. Okay. So maintain temperature chart, very, very important. Second, stages of fever. This in homeopathy case taking is very important. There are stages of fever as chill, heat, and sweat stage. First is aura. Like there are some changes every kid will have, might or might not have. Like in fever, few kids become very restless before the temperature begins. So that is known as aura, restlessness, tossing and turning in bed. And then he will start feeling cold. And then the temperature rises. And then the temperature decreases. There is a lot of sweat and the temperature goes away. So this aura also helps us in selecting the remedy. Of course, ODP, the onset, duration, progress, sudden fever, or there was a gradual rise in the fever. First, there were symptoms of cold and cough for 2-3 days, and then the fever came in, or the fever is there since the beginning with cold and cough or diarrhea or any other systemic symptoms. Investigations, I have always emphasized, investigate if necessary. Do not hold back that we don't need to investigate homeopathy. In homeopathy, we don't need to examine. No, it is very, very, very important. So with this kind of fevers, when a kid comes to you, ranging from neonate to infant or a young child, which are the common remedies you will think of in homeopathy? So the first common remedy is ferrum phos. Now, ferrum phos is a very basic homeopathy, basic remedy for fever, where it is given in the initial stages of inflammation. So there is any inflammation in the body, initial stages, you can think of ferrum phos. But yes, if there is high fever, sudden fever, redness of face, you will always think of belladonna and aconite. So belladonna is given. What are the common symptoms of homeopathy remedy belladonna? There is sudden rise of fever, sudden fever, fever with hotness of the head, fever with blood shot to the head, redness of the face. The child becomes very irritable. Otherwise, the child is very calm child. Kent writes very well as angel when well and devil when unwell. So when you see that child has become very irritable in an otherwise calm child, sudden rise of temperature, hot face, you will always think of belladonna. Aconite, almost similar picture, sudden fever, sudden rise of fever. Usually in this kind of weather, what we are experiencing now, or when the beginning of monsoon, dry, cold winds, or in the winters, sudden rise of fever, hot head, severe headache, but with lot of anguish, anxiety, fever. If there is fever with lot of anxiety and fear as if I'm going to die, oh my God, what has happened? The fever is 99.5, where you can just rest and come back, but the child will be very anxious or a teenager will be very anxious, aconite works very well. Next is gelsemium. Gelsemium is used when there is gradual onset of fever. There was temperature, low grade fever going to high grade, but it has taken few days to come to this, associated with headache, but associated with lot of weakness, giddiness, slowness. Gelsemium works very well. It is give very well fever in hot weather, summer weathers, headache, fever with headaches in summers, gelsemium works very well. Eupatorium perfoliatum, very, very important remedy in fever, where there is fever with lot of body ache and malaise. Bone breaking pain is explained in Materia Medica. So the patients say, I have severe pain, as if my bones are paining, my muscles are paining. Fever with lot of malaise. Fever where the lower extremities feel very cold, especially the shin, the tibia feels very cold. Eupatorium works wonderfully. So these are the common remedies we can give in fever. You give it frequently. You always be in touch with the patient and always assess the trend of the temperature. Now some home remedies. See, apart from homeopathy, every homeopath should also be knowing the home remedies, like what advice you will give to the patient in acute symptoms for the child. What advice you will give to the parents. You have to always give some home remedies, natural. You cannot rely just on homeopathy. So with homeopathy in fever, obviously you will maintain hydration, very, very important, because the child just stops eating and drinking. You will never know with the high fever when the child is going in dehydration. So you have to ask the parents to give them liquids. If they are not eating, no problem. Give them liquid diet, give them soft diet like soft khichdi or something, but they have to drink water. So that hydration has to go. Check for the urine output so you know the child is well hydrated and not dehydrated. Maintain a temperature chart again and again. I emphasize, I'm very strict about that with all my parents, that you give me the temperature chart. Don't give me that verbal temperature that I touched and the skin was very hot and I touched and it was very mild. Maybe it was 100. No, temperature chart with the timing. Tepid sponging or bath. So if the temperature is more than 101, start with tepid sponging, that warm water, lukewarm or tap water, cloth over the forehead, over the body. But if the fever is more than 103, if it touches 104, take the child in the bathroom and put him to the bath. The water, tap water, it should be obviously lukewarm, not cold water, otherwise they shiver. So little lukewarm water, but they have to take bath from head to toe. It will not cause any cold. Parents always have a thing that if there is a fever or हमने उसको नहलाया, तो obviously ठंडी लगेगी, सर्दी हो जाएगी. No, the temperature has to come down. So along with your medicines, give medicines more frequently when there is high temperature. Tap it sponging and then bath. If the fever is touching 104, the kid has to take bath immediately. Okay, so this is fever, the first very important symptom, acute symptom for which kids come to you. And believe me, they don't need paracetamol, they don't need any medicines. Our homeopathy works wonders. Only thing, you should know which medicine to give. You should know what to be watched in cases of fever. Second is respiratory illness, cold and cough. The second commonest thing in pediatric practice, we say cold and cough, recurrent cold and cough, and cold and cough. Okay, so what are the symptoms? Basically cold and cough. So what are the diagnoses? Acute rhinitis, when it is lot of cold. Tonsillitis, when there is severe throat pain. Acute bronchitis, when there is lot of cough. Acute sinusitis, where then suddenly because of the cold the sinuses get blocked. Otitis, when there is ear pain. I have just put this ear pain, otitis, along with cold and cough because it's the same catarrh which causes the otitis. Or sometimes there is bacterial otitis infection, also otitis externa or medium. Examination of the child is very important. Any of the symptom the child comes to you, you have to have a torch in your clinic. You have to have a stethoscope. You should have a tongue depressor. You have to check the throat of the child. Every case of cold and cough, ENT and chest examination is mandatory. Check the ears, check the nose, check the throat. Nose, you check for the discharges, the inflammation, the hypertrophic turbinates, or any polyps, bleeding. Throat, you check for tonsillitis. Sometimes the tonsils are enlarged. The throat is congested, but the tonsils are enlarged but not inflamed. So that is not tonsillitis. That is pharyngitis. So you should know, obviously your clinical knowledge also has to be very strong. And then chest examination for any foreign sound. You should know there is congestion or no congestion. Are there rhonchi? Are there creps? Are there rals? You should be very clear about it. When the child is coughing very badly, when there is wet cough, or in homeopathy we say as rattling cough, barking cough, the every parent will feel that this cough means the chest is congested. But no, when you auscultate, 80% times the chest is clear. It is just the throat irritation which causes this different kind of coughs pertaining to what the symptom child has, and every child reacts differently. So few kids will have a lot of barking cough from day one, but the chest is very clear. When the chest is congested, you know the child is going into bronchitis or asthmal bronchitis. Okay, so examination is very important. The case taking remains common in all this, so I have not repeatedly written as onset, duration, progress, the location and all, change in thoughts. That all is very common. Okay, so what are the common homeopathy remedies we give in cold and cough. Cold, arsenic album, the most commonest remedy. I'm sure post-COVID, everybody, all the homeopathic physician, all layman, everyone in the world knows arsenic album is the remedy for cold. Though it has been used to build up immunity, it doesn't work like that. But yes, arsenic album should be your first choice. If you don't know anything, at least begin with arsenic album. Or if you don't know, if the parents doesn't know anything, at least if they give few doses of arsenic before seeing you to the clinic, the cough will not worsen, the cold will not worsen, and it will help in some way or the other. So arsenic calc, what are the common symptoms of arsenic calc? Sudden cold, sudden cough, there is a lot of burning in the throat, there is a lot of discharges, acute watery transparent discharges, there is increased thirst for sips of water, warm water specifically, and there is night aggravation. And this is the beginning stage of cold where you can use arsenic calb. It's a very generic medicine. But if the discharges are very acrid, when you examine the child, you see a redness around the nasal cavities, around this nasal turbinates. You see that the lips are little red. So that means the nasal discharge is very acrid. It is very hot. Arsenic iode is the drug of choice. Acrid discharges, hot discharges. Few children tell when I blow out the nose, I feel very hot. Or the mother who is cleaning the nose will tell you that when the kids blow out the discharges, I literally feel the discharges hot. This is arsenic alb. Third most remedy, common remedy for acrid discharges of the nose is arsenic iode, arum triphyllum, allium cepa. How do we differentiate acrid discharges, hot discharges, corrosions in the nose? Arsenic iode, first choice of remedy. Second should be arum triphyllum, which is also associated with PND. So along with the acrid discharges, there will be postnasal drip, there will be little dryness, there will be the child will be constantly picking at the nose. This is arum triphyllum. And allium cepa is always watery, profuse discharges, acrid nasal discharges with watering of eyes. And we know that allium cepa has acrid nasal discharge with bland lacrimation, opposite of euphrasia, where there is bland nasal discharge and acrid lacrimation. So allium cepa is the next choice of remedy in cold. In homeopathy, the other one is Kali sulf, where there is chronic cold for many days, thick yellow discharge. Kali sulf works amazingly well. Last but not the least, lemna minor. Lemna minor is a wonderful remedy for cold in this season, damp weather, where there is dryness, basically atrophic rhinitis, more dryness of the mucosa. Lemna minor works very well with postnasal discharge. So there are more than 50 remedies for cold. So I will not be teaching you every remedy, but I will tell you the common remedies which we can give in our practice. And with the commonest remedy, there will be one or two very uncommon remedies which can help in your practice. So with cold, these are the common remedies when a child comes to you for cough. So either the cold ascending into cough or the cough symptoms are primary. Bryonia should be your first choice of remedy when there is dry cough, dry hacking cough, but more in hot weather. Cough as soon as you lie down. When the head touches the pillow, there is lot of cough. Rattling cough, barking cough, hacking cough. Bryonia works very well. Where they are very weak, Bryonia kids are very weak. They just lie down and they don't want to do anything. Bryonia works very well. Next drug of choice is Hipar-sulf. Hipar-sulf has lot of rattling cough, lot of profuse discharges. So profuse yellow discharge from the nose, from the mouth, rattling cough, more in the night, more in the lying down, and throughout the day as well. The third remedy of choice is Drosera. Drosera is a wonderful remedy for barking cough. When there is there is a lot of mucus in the chest and the kid is not able to bring out the mucus, the sound of the uh, cough will be barking. It is always associated with a lot of inflammation. So Drosera cough are lot of barking cough, cough with lot of gagging and vomiting, cough at night time, cough as soon as you touch the pillow, sometimes ending in vomiting. Very good remedy for whooping cough. Similarly, spongia is also the second choice of drug. Spongia cough is also whooping cough, barking cough, but there is lot of cough more on the lying down position in the midnight. As soon as you lie down and there is lot of cough, Drosera works super. When there is cough lying down or in the later part of the sleep, spongia works very well. Spongia cough is better by eating, better by sweets. Drosera is not. It is other way down. Antimony tart. Antimony tart is wonderful remedy for barking cough, cough with gastric symptoms where there is vomiting with the cough and the child is very dull. Very important concomitant. I remember a case like almost 15 years back, a 4-year-old kid had come to me with very, very barking cough. But the parents said, as soon as she coughs, she has become so dull, she just falls asleep. So there is not dullness, there is drowsiness. So cough with drowsiness, barking cough with drowsiness is antimony tart. The sound of the cough is very loud. It is also known as death rattle. So when the kid comes to you or is sitting in the waiting room, when they cough, everyone is alert. With that, if there is drowsiness, close your eyes and just give antimony tart. It will start acting immediately. Next cough remedy, very common, is Rumex crispus. Very, very good remedy for cough. Cough constant, cough throughout the day. Cough at night, but mostly throughout the day when there is constant cough, child cannot keep the mouth closed, constantly coughing. As soon as they inspire cold air, the cough begins. Rumex works wonderfully. Next remedy of choice is pulsatilla. Cough after eating high fatty food. So if the child has gone for a birthday party, has cakes, ice creams and everything, or maybe at home they might have had shira, some fatty food, and the cough begins. Cough at night, cannot lie down. When the cough is there in the night, it is there in the sleep also, child has to sit up. Pulsatilla works amazingly well. Ipecac, and in pulsatilla and ipecac almost same symptoms. Ipecac is also cough after sugary food and dainties. In the night, whooping cough, but cough associated with nausea. And when you check the tongue of the child, usually pulsatilla child has a coating over the tongue. Ipecac has clear tongue. This helps you differentiate, but almost the symptoms are same. Next, very good remedy, Sticta pulmonaria. Sticta pulmonaria is usually cough after measles, cough after any post-viral fever. So if there was a fever first with no cold and cough, the fever has gone and now the child has developed cough, which is dry in nature, more at the night time. Sticta works wonderfully. Squilla is another wonderful remedy of cough where there is lot of cough with sneezing. So any cough when the child coughs ends in sneezing, or there is cough with urinary incontinence. A young girl might tell you, I'm coughing and passing urine while coughing. Squilla works wonderfully. So these are very, very important remedies you should know as a homeopath for cough. And home remedies as usual, ajwain potli. So in small kids, I always advise like a neonate, infant, and even a child, school going kid, whenever there is nose block at sea, whenever you have cold, whenever you child has cold, when the child will lie down at night in the sleep, the nose is going to block. So nose block at night is a common symptom. It is not a peculiar symptom. When you lie down, the nose is going to become dry and the child is not being able to breathe. You should roast little ajwain, what we say, or ova in Marathi. In ajwain, you roast a little, not burn it. Add 2-3 cloves of garlic. Just smash little garlic. Don't smash it like proper like into a paste. Just smash 2-3 strokes of garlic into the ajwain tadka, and then put that into a potli form. Keep it near the child's nose and they will take in this inhaling this, the nose will open up immediately. You don't have to put the nasal sprays, you don't have to do anything. This is a very tried and tested. Since last 20 years, I give this remedy to all my patients. Honey with ginger helps in the throat irritation. If the child is constantly coughing, me just 3 days back, a child had come with cold and cough. Parents called me at 11 in the night that the cough has not gone and the child is continuously coughing. They'd just seen me at 7 in the evening. So with 1-2 doses, the cough will reduce, but the continuous cough will not go. When they lie down, it is going to irritate more. So I advise them, make the child little propped up and give little honey with ginger. So half spoon of honey with just 3 or 4 drops of ginger, not more, because then otherwise ginger is very accurate, causes throat irritation. We are using it for throat to relieve the throat irritation. So the honey with a little ginger, ask them to lick it, not have the entire half spoon together. Constant licking will try and soothe the throat. Also warm water drinking whenever they have cold and cough or throat irritation. And last is tulsi kada, what all parents do. They, whatever they can make kada of, little tulsi with cinnamon, a little black pepper, and a little jaggery or honey. And if the kid can drink that, nothing like that, it will relieve the chest congestion. So ask them to do all this along with the homeopathy remedies. And yes, the most important thing is avoid oily and ghee food, because oily fried food are very throat irritant. When the child is having cold cough, not eating anything, the parents usually make shira or something which is slimy so that they can take it easily, but they don't know ghee or oil is a very throat irritant. Never give them. Stop all colored items. So colored food items like gems or maybe something colored in eating edible form irritates the throat. It causes a lot of allergic cough. So please stop that. And cold food and drinks, obviously they can't have cold food and drink. This you have to advise to every patient having cold and cough. Give your remedy, give home remedies, and give some advice. It enhances your practice, builds up a good confidence between the parents. So I hope I'm clear with this respiratory cold and cough. It was in quite detail because that's the maximum you will see in your pediatric practice. Next is gastrointestinal disorders. So what are the common gastrointestinal disorders? We know obviously diarrhea, constipation, but yes, childhood gastroesophageal reflux disease is very common, where the child spits up milk, vomits out milk even after burping. A small kid of first 6 months, infant who has GERD will not be able to sleep at night, cry all night, will always vomit out milk even 1 hour after drinking, because it doesn't go down, it doesn't get digested. Homeopathy works wonderfully. Second is infantile colic. Anybody, a child from newborn till infant, the digestive system is developing. It has not developed. The peristalsis and the stomach and the mouth doesn't work in coordination. You eat, the food is stored, the food is digested, peristalsis works, and the food goes down. This is how it happens after 1 year of age. In the first 6 months, you eat, stomach can be moving. In peristalsis, the peristalsis will not be coordinated, so colics are very common. So homeopathy works wonderfully in colics. Acute diarrheas and constipation. Yes, acute gastroenteritis, which is almost the same acute diarrheas. Gastroenteritis is diarrheas with vomiting. Acute abdominal pain. Common remedies we use: diarrheas, arsenic alb. Arsenic alb, if you open fatak, if you open boric. First symptom is ptomaine poisoning. So whenever you have eaten anything outside, which might have turned into a poison for you, so you have vomiting or you have diarrhea, you should begin with arsenic alb. This is very, very important. And if they have continuous watery diarrhea, you don't need to give any other remedies. Arsenic alb will first curb the infection. It acts as an antibiotic, and then you give the symptom similarity. Second medicine is aloe. Aloe, we all know aloe socratina is very good when there is frequent frequent stools or diarrheas in summers, when you have eaten something out, frequent diarrheas with lot of stomach pain, lot of tenesmus. Podophyllum is painless diarrhea. So you have diarrheas, but it is painless, profuse, putrid. PPP, podophyllum. Crotontic is very useful when there are sudden gushing of liquid diarrheas. The patient will pass lot of quantities of stool in one go. Sit on the commode and gush off liquid. Crotontic works wonderfully. Moxol with lot of tenesmus. They have a rectal pain while passing stool. Abdominal, rectal pain, acrid diarrhea. Moxol works wonderfully. I had a patient, a small kid of 4 years, just I think 6 months back, with acute diarrhea. Patient got worried. Before consulting me, they already gave the stool sample. The sample had pus cells 100. And then I had put him on Moxol according to the symptom similarity. And then after a week, I had asked them to repeat the stool test. They repeated the stool test. They did not send me and put up a story or I don't know, post on social media saying that this doctor is good and all that. The pus cells after 1 week or 4 days of stool sample was zero. So basically, Moxol is a wonderful remedy. And we have proofs also when you do the test. It's not that you have to prove to every patient, but if the patient wants to, you can always go ahead with stool test. Stool test is not necessary every time unless you are suspecting any kind of bleeding, any kind of dysenteries or bacterial infection. Okay. Chamomilla. Chamomilla is a wonderful remedy for diarrhea during teething. So when a small kid is teething, basically teething doesn't cause diarrhea. During the teething phase, there is something known as mouthing. The child wants to chew and eat everything. So they will pick up everything available. Child is already crawling or on the ground, pick up everything, develop a sensitivity or allergic stomach and start with loose motions, which is very common. Chamomilla works wonderful because with teething, the child becomes very cranky. Imagine the gums, imagine the teeth has to burst open from the gums. It is so painful for the kid. So they become very cranky, especially at night. Chamomilla works wonderful. Second condition is colic, very common in infants. Colocynth, diascoria, wonderful remedies. Colocynth, when we all know, colocynth is acute pain in the abdomen, better by heart pressure, better by bending double. Diascoria is also a wonderful remedy for colic, where there is colic associated with lot of flatulence, and also colic, which is better by walking. So in colic, colocin, diascoria works wonderful. Third common condition is constipation. Constipation in kids is very common, especially the small kids who are formula fed. They can develop constipation. Sometimes there is a tendency of constipation in kids from childhood. So constipation, you should always know, a infant can not pass stool for 7 days also. It is okay. From the 8th day, they will pass because there is a lot of irregularity in peristalsis. This is not called constipation. But if the child abdomen, when you examine, has lot of gases, there is a tight, tense abdomen, you need to intervene, give them medicine. Common remedies, Nux vomica, alumina. Nux vomica, we know that there is a frequent urge for passing stools, but then very little comes out, straining for stool. Alumina is chronic, not passing for many days. Okay. And the home remedies in gastrointestinal disorders are diet. Diet high, like suppose if there's constipation, you give high fiber diet. There's diarrhea, you always tell them to have a light diet of water, of liquid or soft diet food, not more of chapatis and vegetables, because that the stomach can't digest, will produce more diarrheas. So diet is very important in gastric complaints. Infant colic releasing exercises. So I always tell my parents of kids of infants and neonates, directly don't go and give colic aid in allopathy, or don't give colic medicines in homeopathy. When a child has colic, there are multiple home remedies. There are exercises. You can massage the tummy in a particular way. Do the exercise of lifting the child's leg and pressing against the abdomen. This all helps in releasing the gas, and hence the colic will settle on its own. You don't need medicine. So yes, infant colic exercises. Watch for dehydration and diarrhea. Very, very important, because the parents will take the medicine, go back home, child will refuse food and child will refuse drinking water. You will never know when the child goes in dehydration. So urine output checking is very important, and signs for dehydration, very important. So with this, we complete gastrointestinal disorders. And the last common acute symptoms are skin conditions. What are the common skin conditions? Are urticarias or hives. Very, very common. Sudden urticaria, sudden hives, acute eczemas, insect bites, abscess or boils, wounds, hand, foot, mouth disease, very common in this season. So watch for fever with skin eruption. All the skin eruptions above will not have fever, but if there is fever with skin eruptions, the condition is different. It could be bacterial infections, it could be post-viral skin inflammations. You have to watch for that. Common remedies. Pulsatilla is very good remedy for urticarias, where there is urticaria aggravated urticaria after rich food, urticarias with diarrheas, urticarias where the skin gets aggravated, especially when undressing. You will get a lot of itching when you're undressing. Pulsatilla works wonderful. Urtica urens, there will be urticaria, hives, skin eruptions with lot of burning. Voluptuous itching, scratching, but there will be lot of burning. Dulcamara, very good remedy for skin eruptions in this damp weather. And in this damp weather, here and there will be few inflammatory spots. Dulcamara works wonderful. Graphitis and sorinum, wonderful remedies for eczemas. Graphitis for wet eczema, sorinum with dry eczema, dirty looking child, very dry skin, scaling, sorinum. Same with discharge, lot of scaling, long-term graphitis. Rustox is a wonderful remedy for initial skin ailments. If there is anything like skin dryness, skin peeling, boils, psoriasis, if you don't know anything, just begin with Rustox for a week. Some changes will be there in the skin. Patient will develop confidence in you. You will have time to evaluate the case if it is chronic, and then you can give the indicated remedy. Rustox is a wonderful remedy for skin in the initial stages of inflammation. Apis, very good remedy for urticaria, hot skin, red looking skin, angioneurotic edema, very good for insect bites as well. I give very often to the kids when they are exposed, they're traveling and there are a lot of insects and all. Apis works very well. Silesia, very important remedy for pus formations and abscesses. It removes, Silesia has a property, it removes the foreign body. So when there is lot of pus accumulation in an abscess, Silesia works very well to remove the pus out. Myristica sebifera, amazing remedy for the healing of abscesses. So when the pus has come out by Silesia, you can give Myristica for better healing, for faster healing. Home remedies, obviously in skin, ice pack or hot applications as and when required. Most conditions like urticaria, hives, you can always advise them to put ice. It helps to reduce the inflammation. And no local application unless it is advised. So these are the skin conditions common which child will come to you with the homeopathic remedies. So acute conditions we covered was fever, cold, cough, skin. Now we go to chronic and recurrent childhood disorders. So homeopathy can be given in what kind of chronic and recurrent childhood disorders? Recurrent cold and cough, same, rhinitis, recurrent tonsillitis, recurrent bronchitis, recurrent sinusitis, asthma and adenoids. Recurrent GI disorders like IBS, constipation, diarrhea. There are kids who have chronic constipation. They will strain for the stool, sometimes bleed from the anus. Homeopathy works wonderful. So here we have to have a constitutional approach, a chronic approach, or gastroesophageal reflux disease in kids, in teenagers also having lot of acidities and all. These are the common complaints kids come with. So kids, when I mention kids, it is always from a neonate till teenage, okay? And skin disorders as we discussed. In chronic also, atopic eczema has become very, very common nowadays. So many kids, I can say 3 out of 10 or 4 out of 10 kids nowadays have atopic dermatitis, eczema. Homeopathy works wonderful. Detailed case taking with the indicated remedy completely cures atopic eczema. Urticarias, molluscum contagiosum, acne, psoriasis, vitiligo, we have a wonderful scope. Vitiligo in pediatric cases responds so well to homeopathy that it completely eradicates the vitiligo. But you should know what to take in case taking. You should know which medicines to prescribe. Vitiligo in adults, when it starts at an adult age, is a little stubborn disease. But vitiligo in kids is response is very faster, because I think maybe kids have higher susceptibility and they respond wonderfully. Bedwetting, nocturnal enuresis, very common condition, and homeopathy has a wonderful role. Now, my most favorite part, behavioral and developmental disorders, delayed milestones, poor growth, hyperactive or ADHD, attention deficit hyperactive disorder, hyperactive kids, restless kids, aggressive kids, anger issues, concentration difficulty, lot of anxiety and sleep disorders, especially in teenage. Homeopathy works wonderfully. Homeopathy can be given in children with anger issues. Nowadays, small kids, especially school age kids, have lot of temper tantrums, anger issues, become aggressive, hit, bite, lot of complaints from the school. Homeopathy works wonderfully in calming them down, because that anger is not their innate nature. It is due to some kind of stimulus which creates a lot of anger in them. We can always balance that. It helps wonderfully. Concentration, child is not sitting in one place, not being able to study well. Homeopathy works wonderful. I had a child, I remember a case long ago, 15 years back. A child had come to me who was in ninth standard, and I think there were 3 months left for the final exam. The mother said he's just not able to concentrate, he's just not studied, can you help? If you help, at least he'll pass this. I just want him to pass. I said, let me try. I took a detailed case taking. His remedy was Natramure, I remember very clearly, and it was given in frequent intervals. And in that 3 months, there was this finals. I said, I don't guarantee, because 3 months is a very less time. But yes, I said, let's try. At least we have some help. The child passed the ninth standard with good marks. It's not that he suddenly came in ranks, but he was failing in all subjects. He passed in all subjects and finals, and he had cleared his ninth standard. The parents were crying out of joy. So that is the wonders of homeopathy we can help with. Last is autism and autism spectrum disorders. We can help wonderfully with homeopathy. Autism spectrum disorders like sensory processing disorders, there are multiple. We can genuinely help. We can't cure completely, but we can make them individual. They make them independent, which is should be our goal. Now that can be a completely different topic altogether, but yes, these are the common conditions. Other common conditions are thyroid disorders. Nowadays, thyroid has become so common in teenage. I get 4 out of 10 girls, or 2 out of 10 boys having thyroid disorders, either hypothyroid or Hashimoto thyroiditis, which is an autoimmune condition, very common, completely treatable with homeopathy. Autoimmune diseases, other endocrinological disorders. PCOS in teenage girls, 8 out of 10 girls nowadays have polycystic ovary, irregular menses, obesity, very treatable with homeopathy. I have recently had a patient 3 years back, young girl with PCOS, irregular menses, treated with homeopathy, took homeopathy for just 6-8 months, then got married, stopped the treatment. Menses were irregular, menses became regular, her facial hair decreased, acne decreased, and got married, and within 2 months and within 2 years of marriage conceived naturally, when she was not very sure about even trying, because she had a long history of PCOS. But with that 6 or 9 months of treatment of PCOS, menses were regular, all her symptoms of PCOS went away, sonography was normal, and she conceived naturally. She has given a very good testimonial in my on my online account. And lastly, frequent headaches, migraine, hair fall, homeopathy works wonder. So in chronic conditions, what do we do? In all this condition, a detailed homeopathic case taking with well prescribed medicine on basis of individualization brings about the desired cure. So important pointers. Okay, now we have done with what we can help in acute and chronic with homeopathy remedies. What are the important pointers in pediatric cases? Case taking is very important. Physical, mental, family history. But along with case taking, pediatric history, birth history, the birth weight, the weight of the child at the time of birth, the type of delivery, normal delivery, or the child was born out of C-section, why the C-section was done, meconium aspiration, cord around the neck, all that is very important. Feeding history, completely breastfed, exclusively breastfed, mixed fed, only formula fed, why that was important. Milestone history is very important. Teething, sitting, standing, walking, talking, at what age? You should first know what is normal. Milestone, the child has to start teething. The teething will begin anytime from 4 to 6 months. It can also begin after 1 year. Very common nowadays, nothing to worry. Milestones of sitting, the child has to sit with support by 6 months, without support completely by 8 or 9 months. Standing, by the first birthday, the child has to stand independently. He or she starts standing with support by 9 months. Walking, by either first birthday, walking can begin anywhere between 9 months to 18 months. So if a child also starts walking at 18 months, it is not delayed. You should know the range. After 18 months, if it begins, then it is delayed walking. Talking, the child starts talking anywhere. Monosyllables, by 1 year, he should be able to speak monosyllables. Mama, baba, tata. by 1.5 bisyllables, like two words, mama chahiye, give me, something like that. By 2.5, they form sentences of 4-5 words. So we should know what is normal as well. Clinical knowledge, pathological knowledge is very, very important along with homeopathy. You cannot have only homeopathy and rule out this. New practitioners, students, please, if you are focusing on pediatric practice, work with a pediatrician for 6 months, see what they do, how they examine, what medicines they give, what are the vaccinations, everything, their IPDs, you should know normal so that you can treat that normal. Mother's history during pregnancy, very, very important point. I think all points are very, very important. But yes, mother's history during pregnancy, MHDP, both physical and mental state is very important because that gives us a clue to the child's condition. A mother having lot of cold and cough, bronchitis during pregnancy, the child will have recurrent cold and cough. A mother with lot of stress and anxiety, the child is very restless physically. A mentally active or a mentally stressed out mother, or the kid can become a lot of physical restlessness. It is a proven fact I have seen in my 20 years of practice. So all this is very important. Behavior of the child at home, school, with peers, and in clinic. So behavior, how is the child at home? These are important pointers in case taking. How is the behavior of child at school? Kids are wonderful. There are kids who are mad at home but wonderful in the school because they are fearful. There are kids who are very restless, very jumping here and there, not sitting at one place at home and in school because they are like that. With peers means how they are with other children. Can they share their toys? Are they talking to them? Are they liking them? They don't want, they want to stay alone. Very important history. In the clinic in front of you, how they are when they enter your cabin, are they very fearful, crying, approachable kid, non-approachable kid? Few kids are very friendly and will talk so much with you, and few kids will just cry and cry. All these are very important pointers in the case taking, because in pediatric history kids don't speak. Observation plays a very important role. So the behavior of the child, what you observe, mother's history during pregnancy, birth history, milestone, this all along with what the parents has to say about the kids will form a total history, because the child is not going to give you the entire history like an adult. I am very calm and I'm very humorous and my fears are this. No. In history of mentals, always ask details about PTM, parent teacher meeting of school going kid. In school going kids, every school will have a parent teachers meeting either quarterly or every 3 monthly. You have to ask parents about this history, because the parents teachers meeting, the teacher will always give input about good points and bad points. So sometimes the parents might have missed about that in their description about the child. PTM question will always help them recollect, and we will get some important pointers. Last but not the least, observation is the key in child-centric cases. By giving free hand play in the clinic and a blank paper to draw. So you give, like when the child comes to the clinic, you have to observe the child while the child is waiting outside. Is he cranky? Is he restless? Is he playing? How they are behaving with each other? When they come inside the cabin, you keep toys which are sensory stimulators, motor stimulators. You can observe what they like to play, what they like to do. Few kids will just come and do drawings. Few kids will just play with that Hulk and Spider-Man, and a few kids will just take the cars and move around the entire cabin. This will give you the input about the behavior of the child. Very, very important. Blank paper, you just tell them do whatever you want to do. Few kids will just scribble because they don't know to write. They cannot hold. You can see there's no pincer grasp. Few kids will do beautiful drawings even at the age of 2, believe me. That will also give you an input about their intellectual thing. So yes, in pediatric case, all these points are very, very important. So I'll just illustrate case illustration. I'll give you 2 short acute cases, 1 short chronic case. Dr. Mansi, we have time. Can you tell me how much time we have? So I'll just go a little fast or slow.
Yes, ma'am, sure. We can share your other details also.
Okay, perfect. So, acute cases I'll share. They are very short and small and very crisp. Case 1, 7-year-old girl, known case of bronchial asthma under my treatment for recurrent cold and cough, came with sudden onset breathlessness since morning with 1 day history of cold. So there was just cold prior one day. It started with sneezing, watery discharge, and next day sudden breathlessness, which doesn't happen. Usually in the kids, when they come, they will always have cold for 2-3 days. And then if that cold not treated, will go into cough. It will not cause breathlessness. So cold and next day sudden breathlessness. Obviously, because the child was an asthmatic kid, it was fast progression. But this is a very important point to ask them. Onset, duration, progress. This is very important. Asthmatic cough, also complained of asthmatic cough and dyspnea even on rest. The child was just 7. I remember that girl was sitting and playing with my toys and she was like, constant dyspnea, even on rest. I'm talking to the parent and she's like, and that asthmatic cough, there is bronchoconstriction. So the cough will always be because the bronchoconstriction is not released. There is a lot of constriction. Cough cannot come out. There is no passage of air in the bronchial passages. So the cough is like that. Here you have to educate the patient. When I give you medicine, the breathlessness will go, but the cough might sound a little louder because it will loosen up. There will be bronchodilation and the phlegm will try to come out. So this was the case. On examination, throat was mildly congested, but the chest has rhonchi in all the lobes. So examination, very important. You should know what is rhonchi, when does rhonchi come, when is wheezing heard, when are rales, creps heard. You should know all these things. So clinical knowledge is very, very important. I time and again say clinical knowledge, pathological knowledge, medicine knowledge, very important along with homeopathy. So in this patient, I gave natrum sulf 200 in frequent doses. And the follow-up, as you see, in 4 days, I had called them in 4 days, but they had called me after 2 days as I had told them. And the dyspnea was much better, 80% better by second day. And on 4th day, when they had come to see me, the dyspnea on rest had completely gone. The child who was coughing continuously with dyspnea on rest, completely better in 4 days. This is the wonder of homeopathy, and this is knowing the right materia medica. Natrum sulf has asthma in damp weather. In monsoon, in this damp weather, asthma symptoms come, and asthma with every cold. The cold will settle immediately into asthma. Natrum sulf, wonderful remedy. So this child recovered in 4 days, and I just continued the constitutional medicine after the 4 days. Parents were happy, child were happy. You have a satisfying feeling as a pediatrician, as a homeopathic pediatrician, to see so much betterness in this breathlessness. Case 2. You'll see this case on my social media page also. A 3-year-old girl came to my clinic, lifted by parents. Okay, she was under my treatment for same recurrent cold and cough. Suddenly the parents said, we want to see you urgently. Came to the clinic. Father was lifting the child with painful abscess on the left lateral side of the knee. No history of fever, just that abscess. So the parents said कि 2 दिन पहले थोड़ा सा था, we thought it will settle on its own. It did not settle, and now today it's become very big and painful. Can we bring her? I said, of course you have to bring her. Second, then with this, sorry. Okay, so this was the abscess. The first remedy of choice in any abscess, when it is an abscess, when you examine, it was very painful because it was there was a lot of pus inside with a lot of inflammation, surrounding inflammation. Silesia is a wonderful remedy. Silesia 1M was given with frequent doses. The abscess burst open on the 3rd day itself. Parents called me. They said the abscess has burst open. Now what to do? I said, you have to bring the child because I'll have to clean the wound. I'll have to dress the wound. I'll have to see whether dressing is required or no. So this is the day 3 picture where the abscess had burst open. I cleaned the abscess area and I did the dressing for 2 days so that to prevent the secondary infection. Now, when the skin is left open after the abscess, secondary infection is very common because the kids don't sit at one place. They move around, or even if the kid cannot walk and is resting, there are other kids at home, there is infection, air. So you have to do dressing for 2 days. But then this will vary from child to child, from the abscess to abscess. Her abscess was very raw, so I decided to dress it. Here again, the clinical knowledge comes into picture that you should know what to do while dressing. You should have visited the hospitals to know the dressing and nursing care. So I cleaned the abscess. Dressing was done for 2 days consecutive on day 3 and day 4. And to prevent the secondary infection, homeopathy medicine was continued. The second picture which you see down is the day 4. The abscess is completely clean. That is a healthy tissue, but I still chose to cover it and then see again the patient on day 5. After which, from the day 5 onwards, I understood that there is no need of dressing. I left it open, but only applying homeopathic ointment on it, so there is no secondary infection. From day 5 onwards, I had asked them to apply only calendula gel. Now, calendula gel is a liquid form, transparent liquid. It will not cause a layer over this. If you prescribe them calendula ointment, it is sticky liquid. It will stick to this area and then you will have to scrub it out and remove. So this is also, you should know which ointment to give when, even in homeopathy. So this is day 4. And the day 5 picture shows that it is completely healed. It is dried up. There is no acute inflammation also. So I left it open. And then when you see on day 8, it is completely healed. Okay. So patient started walking happily from day 5 onwards, because the patient was coming regularly to the clinic. First day lifted by patient. Third day she was limping. On the 5th day, when this picture was there, she was walking normally, and the parents said she's happily jumping and doing her regular activities. Patient was evaluated regularly from day 1 for any symptoms of fever, bleeding from the abscess site, and sudden knee swelling to check for progress of healing. Now, this is very important. If the child develops fever after even the abscess breaks open, that means the infection has spread to the knee. As this abscess was very near to the knee, I was worried that it should not cause any infection in the knee. So I wanted to examine that, watch for fever, watch for any bleeding and sudden knee swelling or ankle swelling. And no antibiotics were given, no surgical procedures were needed. If modern medicine, if you see the picture on the first day, sorry, if you go this to any allopathic pediatrician or any modern medicine, they will obviously do an IND, incision and drainage, and they will give antibiotics. So painful for the child, so toxic for the child. Homeopathy works wonderfully, remove the abscess completely with no need of antibiotics. So these are the 2 short acute cases I wanted to share to build up confidence in young students, young practitioners, that homeopathy is not slow. Homeopathy is very fast. Homeopathy works wonders if the right medicine is selected along with the clinical knowledge. The doctor should know what to do in the case. Okay, now one chronic case I'll share for the homeopathy in pediatrics. So this is, I have submitted this case. My article is there in National Journal of Homeopathy, February 23 edition. A 2.5-year-old son of a homeopathic physician. One of my friend had consulted me for her son in July 2022 for constipation, chronic constipation, attention deficit hyperactive disorder of the child, accompanied by recurrent cold and cough. And in the child also had a history of phimosis. Phimosis is when the skin of the prepuce doesn't open up completely in the penis. So this was the case. Now the details of the case. The child used to pass stool only once in 3 to 4 days. Very hard, round ball stuck at anus. Many times the mother said I had to manually evacuate it. Such bad was the constipation. Passing of drops of blood for 2 weeks. For 15 days, the child was passing drops of blood. Had also put anal suppository 2-3 times in this last a few months, but with very temporary relief. He was also given opium, homeopathic remedy by the mother, as she was a homeopathic practitioner, but not much relief. Also complains of pain in the stomach often, for which she used to give syrup Colicid, which is a modern medicine. So he's just 2.5 years, chronic constipation, severe constipation, and colic. Mother is still giving Colicid. He has history of frequent cold and cough, falling sick every week, needing modern medicine line of treatment since 1 year. The mother said, I am fed up of giving him medicines. Either it is for cold and cough or it is for constipation. Mother said he catches cold from anyone in the play school, exposure to anyone, air conditioners, changes of weather, changes of season, you name it, and he has cold and cough. And I have to give syrups and syrups. He always has high fever of 102, 1 and 2 with lot of cold and cough. He is sick all the time and with always on medications. He also has phimosis with one episode of urine completely stopped for 1 day 3 months back. So 3 months back, he had that phimosis, acute phimosis. He did not pass urine Full day, consulted surgeon, he had advised surgery, but they had yet not done because there was only one solitary episode. After that, he was okay. Physical generals, very low weight gain of 800 grams to 1 kg in 1 year. He has no appetite, will never ask for food. He will keep food morsel in mouth for long and then spit out, will not chew his food. Takes 1 to 2 hours to eat one meal. Imagine the condition of the parents. The mother is working. She's a homeopathic doctor. The father is working one hour for the meal. It is very tiring for a parent. When asked for cravings, he loves banana. This plus is just my way of understanding that how high is the craving. So he loves banana very much. He loves eggs. He loves sweets. In sweets, waffles and pancakes are his favorite, and he loves milk. Thirst, his profuse. He drinks a lot of water. Urine, of course, the stream is very feeble due to phimosis. There is no acute pain or stoppage of urine, but the stream is very feeble. Sleep is good. He sleeps on right side, but there's a lot of grinding of teeth and occasional nightmares. Wakes up crying. Sweat is profuse. He was a chilly patient. He could not tolerate cold weather. Birth weight is 2.7 kgs. Now, this is the pediatric history importance when I had spoken about earlier in the chronic cases. Birth weight was 2.7, so average birth weight. Elective LSCS by mother. This is the second kid, so the C-section was elective, decided by the mother. Exclusively breastfed and then mixed feed till 2 years. Milestones were normal. Mother history during pregnancy, lot of anger, stress, anxiety regarding work. See, lot of anxiety, physical restlessness in mother. The child is physically, a lot of mental restlessness in mother, anxiety, stress, anger. Child is very, very restless. Did you see? I had mentioned about ADHD. Okay, so this mother's history during pregnancy helps. Now the mental picture of the child given by mother. He's just 2.5. Okay, and this was I remember this was post-COVID. It was an online consultation, and I could see the child running behind the mother continuously. She was sitting on a sofa. There was a balcony behind. The child was just jumping from balcony to sofa, sofa to balcony, running around the mother, pulling her hair. I remember the case very clearly. So the mental picture given by mother was very stubborn, will not let you live, will sleep on roads and grounds when his wish is not fulfilled. So very stubborn, he will throw temper tantrums. We cannot do anything about it. We have to give him what he's asked for. He will give back, he will shout, will always contradict. Whenever explained or told to do, he will always be the opposite. Lot of anger, he will hit, throw, pull hair, kick, which I also saw on the video consultation. He's irritable all the time. You can literally see on his face. He's never happy. He likes hair, especially long, silky hair. He takes mother's hair in mouth. And during the video consultation, he did that. Not when my mother was speaking about the hair. He was jumping, jumping, jumping. Finally sat on mother's neck. And he just was doing this to the hair and then taking and literally eating that hair in the mouth. Okay, so takes mother's hair in mouth, plays with her hair all the time. He's so possessive about that, and he's also possessive about his own hair. He loves going to salons and taking care of himself. Vanity, he loves new clothes. He has his own choice of clothes. At the age of 2.5, he likes to be tip top and always decked up with that powder and kajal. Small kids, they apply kajal here, so he loves all that. Spider-Man is his favorite. His school bag to water bottle, all are Spider-Man. It's most of the kids' favorite Spider-Man, especially the kids who are very aggressive, hyperactive, restlessness. I think, they resonate with the Spider-Man. Egotism, he will never say sorry. If he's scared to hit him also, he will not apologize. He will say thank you and welcome very often. Now, hyperactive and restless, continuously in motion, jumping from one place to another without getting tired. Reckless, jumps without fear. Reckless means there is no fear. Jumps without fear, very mischievous. In April, so a few months back, I had consulted them in July. So 3-4 months back, complained from school that he is very naughty in the school, did not sit in the classroom and started hitting everyone. Will pluck all the plants in the, so it's like he go to the balcony, just pluck all the plants, throw away. That mischievous. He is jumping, mischief every moment, no concentration, but memory is good. Shy and reserved. He takes time to speak to new people. Very loquacious, storytelling, talking all the time, very good in doing mimicry, will imitate his elder sister all the time, but there is no jealousy and manipulation. He's very loving and very caring. He will share his food. Irritability and restlessness and not able to concentrate, cannot share toys. But there's no jealousy, there's no manipulation. He's not cunning. He's Foolish, basically. Mischief, dominating. Hobbies are cycling, playing in water, jumping in puddles. Fears. This is very important symptom in child's history. Fears. That also gives us a gateway into the right homeopathic medicine. So fear of animals, dogs, cats, mouse, fear of dark, fear of alone, not clingy. He's not clingy, but he's very attached to dad and my hair, so mother's hair. Now, remedy given was lac rhesus. This is a remedy prepared from monkey. Lac rhesus 200 weekly for 15 days. I'll come to the remedy after I finish the follow-up. So follow-up after 15 days, mother said he is passing stools every day. Now imagine chronic constipation, not passing stool, passing once in 4 days, bleeding in stool, suppositories not working. After 15 days, passing stools every day. So in chronic cases also, homeopathy works faster. It is not that case is chronic, so homeopathy will also take its own sweet time. No. Okay, well-formed stools. He's asking for food now. Remember, the mother said he just is not asking for food. He will never ask for food, keeps the food in mouth and spits it out. I am so happy to hear him ask for food even at 12 a.m. in the night. Previously, I had to run behind him for food and still he would not eat. Now he's sitting in one place for some time. So that hyperactivity, running, jumping has reduced. Phimosis is okay. We might get him operated in coming vacation. Follow-up after a month, constipation much better, passing stools daily, appetite is good, eating well. See, all the points are improving. Urine started to have a good stream. So in 1 month from feeble stream of urine, he started to have a good stream of urine. I continued the same medicine. Follow-up after 3 months, again, much better, passes stool daily, occasionally skips stools, but the next day is okay. Now that this can happen, like if you diet is also very important. Like you are treating a constipation case, but then the high fiber diet is not there, or the child has eaten outside a lot, especially the refined flour, maida and all. He can have a constipation off and on. So don't think that this is an aggravation or the disease has come back. No, you should always check on the history and know also. So occasionally skip stools when it was he used to eat outside. He's eating well, urine good stream, and so they consulted the surgeon. He said just apply betnovate ointment and wait, no surgery required at the moment. Imagine, from surgery, from feeble stream to good stream, to surgeon himself saying we don't require the surgery because the phimosis is getting better in 3 months time with homeopathy. Phimosis is a very surgical condition, but yes, if you give the right constitutional medicine, there are chances. If the phimosis is not complete phimosis, it might revert. So have faith in homeopathy, have faith in your knowledge. Hyperactivity very less, but still there. See, now a child is very, very hyperactive. Suddenly he's not going to become a good boy, calm down and sit in one place and do all his activities. No, the hyperactivity will reduce to 80%. He still will be restless. Now that is his basic nature, but the restlessness to the extent that he's troubling everyone, troubling himself, will go away. So he cannot sit and stand in one place, but the jumping is very less. Another very important thing, mother said that his touching of that hair is less now. Previously he used to play with the hair very often. Now this is a confirmatory symptom. It is not given in repertory, but when the overall behavior changes, the child calms down, the right constitutional is given, all these minute symptoms also will be better. But now he tries to put hair in mouth, he said. So I understood this is pica, inedible. I inquired, he was putting, apart from hair, many other things, inedible things also in mouth. So pica is always a strong indicator of anemia. I asked them to do a CBC. His hemoglobin came to be 9.8, which is very, very low considering a child. So I continued with the same constitutional medicine, but as and when required, infrequent doses, because he was much better. And for anemia, I advised hematinics to him. So you should also know that because he was putting hair in the mouth, he can put every inedible thing in mouth. No, you have to check for anemia when there is a case of pica. So regarding this case, lac rhesus, a little description, it belongs to the group primates. Key features is hyperactivity, mischievousness, a strong mischief, which leads to a lot of complaints in school. Continuously jumping and climbing, very tubercular, imitating and teasing. Monkeys are very popular zoo animals because of their sense of humor and mischievousness. Entertainer in the group, very intelligent but behaves foolish because he wants to make everyone laugh. Behaves foolish to get attention. They grasp things very fast. interested in new technologies and gadgets. So they behave foolish, but they're not fool actually. Possessiveness with lot of anger, cannot share their things with anyone. Very particular about their things. Very sympathetic, very helpful, loves banana, keeps food in mouth for long. When we see, even when we give them the food, they just collect all the food, keep in mouth, and then they remove and then they chew everything. And what were the DDs in this case? Differential diagnosis. When there is hyperactivity, when there is a lot of restlessness, mischievousness, always insect group of remedies come in mind in children, especially the spiders. But the spiders are very hyperactive, but they're continuously busy and they're hiding. They are very cunning. They are not foolish. They always want to hide. Spiders are not plain mischievous. They are very destructive. So these were the differentiating features which made me eliminate the insect group and select the monkeys. Monkeys are very loving, caring, humorous, imitating, happy around their people are very happy around their restlessness. And keywords for selecting lac rhesus was hyperactive, mischievous, jumping, imitation, intelligent, storytelling. So everything covered so beautifully with the remedy. And because I had the knowledge of lac rhesus, I could give lac rhesus and he got completely better. The child is not on homeopathy now, doing very well because the mother is my friend. I keep on asking for the follow. He's doing very well, not on medicine. Sometimes off and on cold and cough, the mother calls up and I give the acute remedies. He's not on constitutional now. Phimosis never needed treatment. It is completely better now. Okay, so the conclusion, homeopathy is fast when correctly selected medicine is given both in acute and chronic diseases. You saw in both my cases. Knowledge of pathology and clinical medicine is very important. It helps in both diagnosis and the prognosis of symptoms. You know what is going to happen. In abscess, I knew that I had to check for the burst of abscess. I knew I had to check in the case of abscess. I had to check for fever or any localized signs of infection or inflammation because it was very close to the knee joint. So knowledge of pathology, clinical medicine, very important. Homeopathy's strength lies in holistic and individualized care. We treat the patient and the disease and not only the disease. Homeopathy helps in reducing recurrence of symptoms and hence helpful in preventing care of disease. That is what we do main. Like we build up the immunity and then finally the recurrence of symptom reduces, the trigger factor reduces. Always counsel the parents and patient about the disease, about the lifestyle changes if needed for the presenting complaints, like healthy food habits, good sleep routine for kids, structured, unstructured physical activity daily, healthy, calm environment at home. So recently a 5-year-old kid had come to me with severe acidity, referred to me by a gastroenterologist because he didn't want to give many allopathic medicines, severe acidity. But then for homeopathy reference, I gave him the constitutional medicine because it was a chronic thing, but I had to educate the parents. He was on total junk food, aerated drinks every single day, sleeping every day at 2 a.m. Imagine a 5-year-old kid sleeping at 2 a.m., getting up at 8 a.m. in the morning. Not a good sleep routine. So I had to educate complete stoppage of junk food, eat only healthy. I told that in front of the kid so that the kid was also in confidence. And no sleeping at 2 a.m. There should be a proper sleep routine. Go to the bed at every day at the same time. Switch off the lights. The child might take 1 hour, 2 hours to sleep initially, but the routine is necessary. Finally, he will fall asleep at the same time, around the same time by 1 month. And structured and unstructured physical activity is a very important factor. I give this advice to every kid, especially the kids with hyperactivity and restlessness. Structured play, sending them to gymnastics, athletes, skating, cricket, dancing, whatever. Lot of physical energy, if not went out correctly, can lead to a lot of mental energy. So then the hyperactive kids will become very aggressive kids. So they have to vent out their physical activity, put them in sports. Structured. Unstructured is take them down the building, let them play, do whatever they want to do with their friends alone. So that is unstructured play. Every day, 1 hour of unstructured play is very important. 3 times or 4 times a week or 5 times a week, structured play is very important for all the kids, but for hyperactive kids, it's mandatory. Healthy, calm environment at home. Like if you feel the family is a little dysfunctional family, or if somebody has an aggressive nature, you have to educate the parents that healthy, calm environment is very necessary. Okay, and never shy away to refer to the patient to senior physician for diagnosis and opinion of treatment. Please, 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 if a child comes to you with any kind of skin complaints, you don't know what to do, refer to a dermat. Ask the parents, go to a dermat, come back to you with diagnosis, you give them the treatment in homeopathy, but refer. You might not know all the diagnosis. So refer. If you can't, if you feel the case is stuck and it is not going forward, vitiligo cases, psoriasis cases, refer to senior homeopathic physicians. Let them help you, guide you. If not, at least you will know the diagnosis, you will be sure about the treatment. So please refer when necessary. You should know, if a case of bronchitis comes to you with high fever, you have to be in touch with the patient along with the fever history. Chest examination is very important. Saturation is very important. If the patient of bronchitis, the saturation decreases less than 90, you have to tell them to go to the pediatric emergency. Sometimes the saturation drops very bad and they require hospital administration, they require artificial oxygen. You cannot just rely on completely on homeopathy. The clinical knowledge comes into picture. So you should never shy away from referring them to the allopathic pediatricians, modern medicine specialists, or senior homeopathic physicians. Be open about it. Finally, the patient is important, not your pathy. Know when to refer and involve developmental pediatrician, child psychologist, behavior analysis for therapy, or occupational therapy. So, like, if the child of delayed milestone comes to you who is not mingling well, you feel a lot of lag is there are developmental pediatrician who will assess the kids with all the activities and give you a big report which will help you that which in what category the child falls to, and which will help you in your treatment only. So referring to a developmental pediatrician, you should know when to refer, what kind of cases to refer. Child psychologist and counselors, very important. If you feel there are kids with anger issues, depression, anxiety in teenagers, all this has become very common nowadays, refer to a child psychologist, refer to a counselor. Every school has a counselor, or you can also have friends who are counselors. They can take therapy along with homeopathy and it works wonders, believe me. Behavior analysts who will analyze the behavior and tell them which therapy is necessary. Occupational therapy, kids who have sensory processing disorders or kids who are with sensory disorders, they require occupational therapy along with homeopathy. So you should know when to refer, what to refer, and what the patient needs, so that we can give a holistic cure to the patient, a holistic help along with homeopathy. Don't be in that air that we can do everything. No, we can do, but along with this, you should be very open to sending the patient. So finally, my session comes to an end. Medicines cure diseases, but only doctors can cure patient. So yes, that's just like Hahnemann says, we should cure the patient in the disease and not only disease. So this is a quote by Carl Jung, which has stuck to me. We as doctors can cure patients and not only diseases. Thank you. Thank you for having me here. Thank you for listening patiently to me. And I hope I could deliver and build a confidence and knowledge about homeopathy in pediatrics. Thank you. Are there any doubts anybody would like to ask?
Yes, ma'am. So, anybody from the audience want to ask any question? So, ma'am, Parul Agarwal is asking, good afternoon, ma'am, which is the preferred way of giving medicine to babies, crushed pills or liquid potency in mother's milk?
Okay, so now if a child is less than 6 months of age who is exclusively breastfed, you cannot give them liquids also directly, because only exclusively breastfeeding is allowed. So what I advise, what I have been doing in my practice, I ask them to crush the pills in few drops of breastfeeding or for breast milk or formula milk, whatever you are giving, just take half a spoon, crush two pills, mix it properly and give them, because large quantities also they might gag. So if a child is less than 6 months, I always advise to mix crushed pills with the milk, whatever milk they are giving. You can't give liquid, otherwise then the milk will be diluted. So that helps.
So, Parul Agarwal is again asking, ma'am, can you please explain a bit about lac rhesus and why you chose it in this case?
Yeah, I think I explained in quite a detailed way. I mean, that pointers to lac rhesus. So basically, lac rhesus
Mm,
is a remedy
mm,
prepared from monkey's milk. So how monkeys are, we usually see them as very lively, bubbly, jumping, very mischievous. So when a kid comes to you who is lively, bubbly, joyous, you can think, but with that, they're very hyperactive. Have you seen a monkey who is
mm.
just walking silently? No, they will always
Yes,
do
yes.
something. They will be picking your bags or
Huh.
throwing things and all. They love imitating. They will always imitate. You do something, they will always imitate you. They are very caring, very attached to mother. You will always see that baby monkey sitting with a mother. So when you see these kind of things, in a case, a hyperactive kid, a restless kid, but who is very loving, who is not cunning, who is not destructive, loves imitation, very loquacious, very talkative, who is like who's like a part of the group, like the active member of the group, many friends, very friendly, very mischievous, but not destructive, you can always think of lac rhesus. Obviously, this mammal themes have to be there, that a family is very important, loving and caring, and building up stories. So that made me select lac rhesus.
Very wonderfully it is explained, ma'am.
Yeah.
And so we have the attendees. They are complimenting your session. Like Payal Krishna is saying, excellent session. Thank you.
Thank you so much, Payal.
And Dr. Ashish Kumar Nath is also saying, thank you, ma'am. It is very informative.
Thank you so much, Dr. Ashish.
Dr. Vain Rao is saying, very nice and informative webinar. He's from Hyderabad, Telangana.
Oh, thank you. Obliged. Thank you.
So Neha Bajwa is asking, ma'am,
Hmm.
can you please suggest a way of repertorize pediatric cases or some important book for pediatric cases?
Yes, so there are many books of pediatric cases, homeopathy in pediatrics. There are very good practitioners, senior practitioners. There's a good book of homeopathy in pediatrics by Dr. Farooq Master, wonderful book. There is a very nice book of homeopathy in pediatrics, if I'm not mistaken, Jonathan Hardy International, and one book by Dr. Nancy, international authors, which is very good. Dr. Praveen Jain, he is specialized in homeopathy in pediatrics. Then Dr. Sunil Anand, who's an international practitioner now, he is also very specialized in practice in homeopathy in pediatrics. So his books are also very useful.
So, as we are currently talking about the books for pediatric cases, ma'am, there is a new book that is also published by Bijan Books, that is Clinical Pediatrics Cases from Dr. Ruchi Shirodkar, ma'am.
Sorry,
So,
sorry, you're not audible.
recently, hello.
Yeah.
So, as we are, ma'am, talking about the books for pediatric cases, I would
Mhm.
like to inform there is a new book that Bijan Books has published, that is Clinical Pediatrics, which
Bye.
is written by Dr. Ruchi Shirutkar.
Okay. Oh, lovely. I'll go through
So,
it, surely.
sure, sure, ma'am. And she has shared her cases in her experience while treating her pediatric cases. So, that book can also be helpful.
Yes, yes, 100%.
Next, we have other compliments from the audience, like Isha is saying, marvelous, wonderful session, ma'am.
Thank you so much,
And
Isha.
Nitin Roy nicely explained. Thank you.
Thank you.
So, thank you so much, everyone, for participating in this session so wonderfully, and for making this webinar more engaging and interactive. And a big thank to you, ma'am, Dr. Aditi Salvi, ma'am, for for presenting your cases, your experience on the pediatric cases very nicely, and we learned so much information from you. And we
Thank you.
also learned the basic drugs that we use in our daily life in the practice. Today we have gained so much knowledge about those little medicines and the new medicines also. We learned new medicines also, ma'am. Thank
Yes.
you so much.
Thank you for having me here. Thank you so much. Thank you for giving me a platform to share. Thank you for approaching. It was a wonderful time. Thank you so much.
Thank you, ma'am. Lovely session from you. So this
Thank
session will be available on the YouTube on Homeopathy 360 channel, and you can also share your suggestions and your
Yeah,
thoughts.
please pass on this, and you can always ask your queries on the comments, and I will be there to reply. And Dr. Mansi, you can coordinate with me if there are more queries. We can reply it.
Sure, ma'am. Of course. Thank you so much, ma'am, for being
Thank
such
you.
a
Have a
beautiful.
lovely day, and believe in
Thank
homeopathy.
you.
And homeopathy is fast. The bottom line is homeopathy is not slow; it is fast, and it is
It is
wonderful.
fast.
Yeah.
Yes, ma'am. True.
Thank you.
Okay, ma'am.